Hi guys, welcome back. If you are new here, I'm Chantel Purcell. I have been sharing my experiences through cancer and treatment and surgeries and life after cancer and life during cancer, and most recently an arm paralysis after a surgery for a cancer related surgery. So if you are new here, I just invite you to go back and maybe check out a few of the previous videos, and that'll explain how we got to where we are today. So today I'll just share that we're still, as far as like ability of my arm, it's still pretty much the same. We've really intensified and sort of not changed up, but we've added more stuff to my physical therapy. So we're working really hard to kind of get those nerves signaling signals to the muscles. So it's just not communicating yet. And but I am super optimistic. So look, I think if anyone has patience, it's this girl. Like, I have been so patient. Now, with that said, you guys, like, I'm human. Like, I lose it every now and then. I get angry, I get frustrated. Sometimes I get sad and I'll have a few boohoo moments and just kind of feel sorry for myself. Like, mostly it's frustration. I mean, I'm learning how to like deal with a disability. So, I mean, it's, of course, it's hard. So, I mean, if you've ever had something that, you really like in your mind you want to do, but your body is just saying no, like, not yet, not now. Look, I mean, it's hard to stay encouraged and to not get discouraged sometimes and not get angry and frustrated. And, so I'm extending myself grace when those moments come. And rather than get, as I say, stuck in the sticky parts, I've really been working diligently to refocus my energy and my thoughts on what I can do versus what I cannot do. Because when I have those moments, it's usually because I'm just really extremely frustrated of something that I'm unable to do. And so, it's been 5 weeks now. I'm 5 weeks post-op. And so over the last 5 weeks, as you can imagine, I mean, everything from brushing my teeth to trying to, get dressed, trying to go to the bathroom, pulling your pants down before you wet yourself, or getting them back up after, I mean, it's just all the little things, trying to put makeup on with one hand and my non-dominant hand. I mean, but, it's all taken work. Now and then, I mean, let's talk about like trying to feed myself. Forget about cooking a meal, but I mean, just trying to feed myself. Like, I can't cut anything with a knife. We've got, you've got one hand for one utensil, not two hands for two utensils. So, I mean, literally everything in my life has been a relearning over the last 5 weeks. So, if you can relate in any way, but I'd love to hear from you. First off, like, please, like, drop a little comment in the comments below. I'd love to hear about, maybe what you've been through, or, maybe a tool or tip that you used when you were struggling, kind of past those moments of, frustration, anger, sadness, like the why me. I haven't had the why me so much, but I know, that's not uncommon. That's a very natural human emotion and response to anything like this, right? So, but yeah, I mean, so I guess overall, you guys, is I have been so diligent with my thoughts, and really, especially when I have those moments of frustration of I can't do this, I instantly kick into what can I do? How can I pivot? What can I do that's similar? How can I maybe create similar results, or like get there without going the route that I'm used to going? I need like a whole new pathway to get there, or maybe, the road's closed completely and we need to come up with something else, like in place of. Everything has literally been a learning process this whole time. And I think my key point and sort of takeaway is, if you're going through that kind of challenge, or if you find yourself facing that yourself, like in the future, for whatever it is, it could be, physically kind of related to like a surgery or recovery, or an injury, like who knows, but whatever the circumstances are, if you find yourself kind of having to relearn common daily tasks, of course, I mean, like it can be highly stressful, emotional. It is an emotional journey, you guys, for sure. And it's challenging. My sort of way to pivot through it, and way to stay positive and optimistic and not beat myself up is first, I extend grace to myself. Like, you know what? Give myself some time and some patience with myself to learn how to kind of navigate this new path. And then secondly, don't get stuck in the sticky parts. If you feel the emotions, have them. Don't deny yourself the crying, the anger, the yelling, whatever it is that you feel you need to do. Like, I've extended the grace and the patience for myself, but I've also allowed myself to feel what I'm feeling. Don't stuff those feelings, let them out, and then move on, like in a healthy way. And that actually helps me to move on. And so then that third part is when I do move on, let's look at this in a different, from a different angle. Let's take a different perspective. Okay, this is what I can't do over here. I can't do it this way. What can I do? And so really focusing on what I can do, what I'm able to do, rather than what I can't and what I'm unable to do. So that's kind of like my little tidbit for today. Thank you guys from the bottom of my heart for just the love and the messages, the support that I get from you. It just means so much. And my door is always open. I am always here to help you through whatever journey you're going through. So if I can be supportive for you, please don't hesitate to reach out, leave a comment below. I've got contact information in multiple places that tells you how to get in touch with me. So please don't hesitate to do that. So I just want to say thank you for being here. Thank you for following along. Your liking and subscribing to this channel and my videos helps these videos to actually, the algorithm, to help them reach the people that they need to reach most. So thank you for doing those things. And I'm just so incredibly grateful for you. So until next time, my friends, go live your best life, and I'll be doing the same. Thanks.